Feeding your baby is a habit that you build over time. It gets easier each time you do it, and you get more clarity on what's working and not working for both you and your baby with every feed. We really believe in neutral language, which is why you're going to hear me use the term body feeding and breastfeeding interchangeably. Body feeding means feeding your baby using your body, which could look like bottle feeding using your hands or breastfeeding using your breasts. Body feeding could also mean feeding using your chest if you're a non-binary person or someone who doesn't identify with the word breasts. The most important thing is feeding your baby and feeling confident about however you're deciding to do that. Now, before we go into the hands-on components of how to feed your baby in these first few weeks, I think it's really important that you understand how human milk production actually works and a few key insights into how to feed your baby using formula or donor milk. So let's start off with a few human milk basics. One of the questions I've gotten the most throughout all my years of teaching is, do I have enough milk? And the answer is yes. Your body already started making milk around 16 to 22 weeks of pregnancy. Now, after your placenta is delivered, whether that's through a vaginal birth or through a cesarean birth and the placenta is surgically removed by your OBGYN, once your placenta is no longer in your body, that's when your body knows that you're no longer pregnant. And it continues to make milk, but there's a big difference. That milk production process is now going to be controlled by you and your baby. Prior to you giving birth and prior to your placenta leaving your body made milk regardless of what you did. It didn't need any direction. But now that your body has given birth and your placenta is no longer in your body, you and your baby have to tell your body what it needs to do. So what that means is that constant feeding or constant stimulation of the breast through pumping is what's going to help your body to continue to make milk. If you don't stimulate your breasts or you choose not to feed your baby from your breasts, your body will actually stop making milk. So how often do you need to feed your baby at the breast or stimulate your breasts using a pump to make sure that your body continues to make enough milk to feed your baby? To do this, you need to make sure that you're stimulating your breast or feeding your baby at least every 4 hours within those few hours and days after birth. In fact, it's important within 6 to 12 hours after birth that you have an effective feed or an effective pumping session. The longer you go after birth without stimulation at the breasts, that can actually impact your milk supply 3 to 6 months down the line. So making sure that there's adequate stimulation at the breast in those early hours is really important. That said, when your baby is born, they need a few hours to transition. So don't expect for there to be an immediate feed directly after your baby is born. Sometimes they do latch and start to feed, but I like to give babies anywhere from 1 to 3 hours after the intense event of coming into the world to start feeding. And my reason for that is because babies are actually not born hungry. Their stomachs are filled with something called meconium, which is their first poop. Now, before I dive into what your baby is going to need around feeding, there's one more thing I want to mention. I let you know that you already have enough milk in your body at 16 to 22 weeks to feed your baby through those first few days of life. And then I shared that after you birth your baby, and your placenta is no longer in your body, that you and your baby, through frequent feeding or through frequent stimulation using a pump, are going to now determine how much milk your body is going to make. However, depending on how your birth process went, there can be some delays in your milk increasing in volume. And that's also a really important term. Your milk doesn't come in, it's already there, but it changes in the amount of volume that's present. So that change in volume can be delayed by a few things. One, a very long birth. The reason why a long birth can delay your milk volume from increasing might be because you've had multiple interventions that have required a lot of extra fluids to be put into your body via an IV. Extra fluid in the body can slow down the hormonal process of letting your body know that it's time to make more milk. We call that third spacing. So, if your birth lasted more than 24 hours and you received a lot of IV fluids, keep in mind that it might take an extra day to 2 days, maybe even 3 days, for your milk volume to increase adequately enough to meet your baby's needs. Another reason why your milk volume might be delayed could be due to blood loss during labor. If there's any excessive blood loss or hemorrhaging, that can delay your milk volume from increasing. A common example of a birth experience that could lead to third spacing could be a birth that starts with an induction, multiple rounds of IV fluid are given, followed by an attempt at a vaginal birth that failed to progress and then ended in a cesarean birth. That birth journey can lead to a lot of fluids being put into the body and can create an environment that leads to third spacing. If that is your experience, it's important to be patient as you wait for your milk volume to increase. It's also going to be important that you're proactive and make sure that you're stimulating your breast every 4 hours, whether that's with your baby nursing at your breast or using a pump to make sure that you're getting adequate stimulation to support your milk supply. Now, let's dive into your baby and what's going on with them when it comes to feeding in those first few days and weeks. Like I said, babies are not born hungry. Their stomachs are filled with meconium, which we call their first poop. Their stomachs are also really small. A newborn stomach is about the size of a shooter marble the first day that they're born, which means that they really only need about 1 teaspoon per breast per feed within the first 24 to 72 hours. It's going to be about 2 teaspoons every time you feed your baby, which would be fed to them using a syringe or an SNS system, which is a supplementary nursing system. And the reason why I want you to know how big your baby's stomach is at that early stage is that our culture has shown us when babies are being fed, they need a huge bottle of milk in order to feel full. That's not the case. And in fact, by the time your baby is a month, their stomach is only the size of an egg, which means you're working slowly up to feeding your baby larger volumes of milk. So when I say to you that your body already has enough milk to feed your baby, that's because your baby actually doesn't require that much milk. And your baby and you are actually working in tandem in the sense that as your baby's tummy starts to stretch, your milk supply continues to increase in volume. So there's a couple of different amazing ways that you and your baby are working together during this new phase. I think it's time for an anatomy geography moment. And to do that, I have my handy bio breast model. I want to quickly share a few things and point out a few things about breasts. Firstly, this is the areola. Your areola probably changed a lot during your pregnancy. It might have gotten darker, bigger, wider, all totally common and helpful if you're choosing to breastfeed because it helps your baby to actually locate and find your breast. That's because babies really can only see high contrast in those early few days and weeks. So the high contrast between the dark areola and your lighter breast helps them find their way to your nipple, which is over here. Before I go into your nipples, I do also want to mention these fine little bumps that are on the areola. These are called Montgomery tubercles. They secrete a fluid that helps keep your breasts at just the right acidity to help fend off any bacterial growth, which is why you don't need to wash your breasts every time you feed because your breasts are actually doing a little bit of their own self-cleaning and balancing all on its own. And then we have the nipple, which has about 12 to 15 openings. When your baby is suckling on the breast, the milk doesn't squirt out in one direction. It actually sprays like a shower head. You'll never be able to see that while your baby's actually feeding, but when you're hand expressing or when you're using a pump, you'll be able to see that spray.
When a latch is well placed, your baby latches on and draws your nipple deep into their mouth, all the way back to where their hard and soft palate meet. Your nipple, which is made of erectile tissue, enlarges and expands to almost 3 times its size. And then the 15 to 20 holes at your actual nipple spray the back of your baby's throat with milk. When your baby has a good latch, their tongue is nowhere near your nipple. In fact, their tongue is massaging underneath the areola, and they're simply just drinking at the breast, not sucking on your nipple like a straw. That's why over time, breastfeeding can be pain-free and potentially even soothing for both you and your baby. If you're feeling pain at the nipple, it probably means your baby has a shallow latch and needs to be readjusted.
Another thing that's going on in this phase is something called engorgement. You might have heard of it from a friend or read it somewhere, that when your milk starts to increase in volume, your boobs get huge. They do, but there's 2 kinds of engorgement. And the engorgement that I would like you to experience is normal engorgement, as opposed to acute engorgement. Now, engorgement means that your milk volume is increasing, and there are things that you can do to help support yourself when that's happening. Engorgement typically takes place within 3 to 7 days after the birth of your baby. One of the things that you can do during engorgement to help yourself is hand expression. That's going to help take some of the pressure off of your breast and help release some of the milk. So hand expression is going to differ from person to person because every breast is different. This breast is actually quite small. You might find that you have larger, more pendulous or hanging breasts. So really just figure out what's going to work best for you. So for the purposes of demonstrating, here's how you can hand express. Using your 4 fingers and your thumb, bring your thumb up to the side of the breast and bring your 4 fingers underneath your breast. Take your thumb and roll your thumb towards your areola and nipple, squeezing with your 4 fingers below. And do that a few times. And as you do that, unlike this bio breast model, milk will begin to gently drip out of the nipple. Another thing that I want to mention is something called reverse pressure softening, which is when you take your 2 fingers and press back into the areola, into the chest wall, and release. The reason why you would want to do reverse pressure softening is unlike this bio model where the nipple is everted and out, sometimes as your breast starts to fill with milk, the nipple can retract in because your breasts are getting so full and also are getting a little hard. So reverse pressure softening can help to bring that nipple out. Hand expression also can do that, but reverse pressure softening is probably more helpful when it comes to bringing the nipple out. Another thing to keep in mind is that breast tissue is not just in the area that you normally associate with your breast. Breast tissue actually extends all the way up into your armpit. It's actually called the tail of Spence. And when your breast starts to fill with more milk, you can feel that filling sometimes all the way into your armpit. So when you're massaging, you want to make sure that you get into this area too when you are going through engorgement. Sometimes you might find little nodules or balls in this area that feel pretty firm. They're actually just filled with milk. So the idea here would be to actually massage down from the armpit through to the breast when you are getting super full during that early engorgement period. If you do these steps along with hot and cold therapy, which I talk about more in the bodily sensations and recovery module in this class, you will have what I like to call a normal filling process, as opposed to getting super engorged and having acute engorgement. Let's go back to your baby. How do you know your baby's actually hungry? Well, the number 1 hunger cue that your baby is going to give you is having their eyes open, which I know sounds kind of wild, but your baby really only has a few things that it has to do in this early part of their life, which are feed, sleep, poop, and pee. When your baby's eyes are open, that's actually the best time to get your baby to breast or to offer them a bottle because they're relaxed and they'll be easy to get organized at the breast or organized around bottle feeding. Now, other hunger cues include your baby turning their head to the left and the right. We like to call that rooting. Tongue thrusting, so seeing their tongue kind of gently come out of their mouth a few times is another great sign. How do you know a feed is going well? There are a few indicators to tell you that, but I want to share with you the most important one, and that's pees and poops or output. If your baby is peeing and pooping at the regular amount that we need to see in those first few days and beyond, that's how you know a feed is going well. How long you keep your baby at the breast doesn't determine whether or not your baby's getting enough milk or getting enough fluids. It's really going to be those pees and poops. So don't worry so much about 20 minutes on one side and 20 minutes on the other side. That's old information. The most important thing is even if your baby's spending 2 minutes on one side and 5 minutes on the other side, but is having regular and normal pees and poops, your baby's getting exactly what they need. Now it's time to dive into the hands-on tactical steps of feeding your baby in the first few days and weeks after birth.
When setting up for cross cradle, make sure that your baby's tummy and your tummy are facing the same direction, tummy to tummy. Use your thumb and your 4 other fingers to wrap around the base of your baby's neck and skull to cradle their head and bring your baby onto your breast, while using your other hand to adjust and cup your breast. Once latched, if you find that your baby's slipping off the breast, avoid pressing the back of their head or skull forward. Instead, try to bring your baby more onto the breast by pressing into the back of their shoulder blades using the heel of your hand. That will open up their chest and help them extend forward, keeping them further and more deeply latched. Also, once you're comfortably latched, if there's any remaining discomfort, you can always use a stress ball to squeeze as your baby continues to feed, or toe separators, which you can push into and stretch into to distract and manage the pain, especially in those first few early feeds, in those first few days. Pain should only last 10 to 60 seconds. If pain continues beyond that, reach out to a lactation consultant for support. Also, keep in mind that your baby is able to breathe even when they are deeply smushed onto the breast. If your baby's nose gets blocked while they're nursing, they'll open their mouth and let go of your breast so they can breathe. So you don't need to try and push back your breast tissue in order to make space for them to be able to breathe. Because when you do that, it actually makes the latch more shallow, which can create more damage and pain to your nipple. Also, try using a breast pillow to help bring your baby as close and as high up to your breast in order to make it easy to bring your baby onto your breast and get a good deep latch. Side lying is a cozy position, but it usually works better when your baby is a little older. Try it around 7 to 12 days after your baby is born. Usually around 2 weeks is the sweet spot, and it's a great way to make feeding more relaxing for you. When you're positioning yourself, always make sure that you and your baby are tummy to tummy. And also, make sure that your baby is positioned a little lower than where your nipple is. If your baby is a little lower as they open their mouth, they'll have to reach up and pull the nipple down into their mouth, which will create a more comfortable and deeper latch. Also, you always want to bring baby to breast and not breast to baby. It also helps to straighten your bottom leg and bend your top leg, which will curl you towards your baby. Use your top free hand to position your baby as the feed continues. If you're pumping in the first 0 to 4 weeks, it'll probably be with a hospital-grade pump like the one you see here. Hospital-grade pumps do have more strength than personal pumps, and you can rent or purchase a hospital-grade pump. Typically, pumping is recommended to begin when your baby is 2 to 3 weeks old, in order to begin incorporating a bottle. If you start pumping before then, it's usually because your care provider is concerned about your milk supply and how much milk your baby is transferring during feeds. If that's the case, then here are a few things to do to keep you comfortable while pumping. Firstly, make sure that your breast shields, also known as phalanges, are the right fit. It can also be helpful to lubricate the phalanges with a little bit of nipple cream before placing them on your nipple in order to make the pulling or tugging sensation that happens with a pump more comfortable. Toe separators can be a great way to redistribute some of the tension and discomfort happening at the breast while pumping or feeding. So if you find pumping very uncomfortable before you start, put on the toe separators and then turn on your pump. And as the discomfort begins to show up at the breast, stretch your toes wide in the toe separators to help distract from that pain. The same tip applies when you're actually feeding your baby at the breast. Toe separators can be a really simple way to manage any pain that might be occurring while your baby is latching, especially if that pain is only for the first few seconds during the feed. A few other quick pumping guidelines to be aware of are: pump for at least 5 minutes, but no more than 20 minutes. Gauge the amount of pumping time you need based on how much you yield. When I say yield, I mean the amount of milk that's released from your breast. It's more important to pump for yield than for time because everyone's breasts and bodies are different. So depending on the goals you have around your pumping that you've established with your care provider and your care team, you'll pump to reach those exact goals. Also, when you're using a pump, if it feels comfortable, don't be afraid to put the suction and the speed up to the highest level you can tolerate. That's going to increase the efficacy of the pump. If you put the pump at a low suction and at a low speed, the pump won't work as efficiently, and it might take you 2 to 3 times longer to pump the same amount of milk. That said, right size it for yourself. You might need very little stimulation to get the exact amount that you need. What's most important to remember here is to figure out what works for you. There are storage, hygiene, and infection tips about pumping and also bottle feeding in the guide. When it comes to pace feeding with a bottle, you always want to try and mimic the experience at the breast, which means it's important to take little breaks every 5 minutes or so to give your baby a chance to recover like they would naturally at the breast. When offering your baby a bottle for the first time, have your baby be upright or semi-upright and do your best to drag the bottle nipple from the top of your baby's nose down to the top of your baby's upper lip. Do that a few times. That'll help encourage your baby to open their mouth wide, just like they would on the breast, and then latch themselves onto the bottle. Also remember to switch sides as you bottle feed, just like you would at the breast. This is how you can create an easy relationship between breast and bottle. When choosing a bottle nipple, slow to medium flow will be the best way to start. From there, observe your baby. If there's pooling of milk at the sides of their mouth, the nipple is probably too fast. And if your baby's refusing the bottle, then the nipple flow might be too slow. The best time to introduce a bottle would be within 2 to 4 weeks after birth. This will allow others to help you care for your baby and make sure that your baby has the bottle exposure they need if for some reason you're unable to breastfeed or there's an emergency. If you're focused on exclusive breastfeeding, offer at least 1 bottle a day around 2 to 4 weeks. That's a great and simple plan. If you're formula feeding, make sure you mix and measure carefully, don't warm formula bottles in the microwave, and don't use formula that's been sitting at room temperature for more than 2 hours, and make sure you discard leftover formula if your baby doesn't finish the bottle you've made up. Now on to burping. Stay curious and find the right burping style for you. Try burping your baby upright, holding their chin using your thumb and your 4 other fingers, creating a cradle for their head. Your baby can also go high up on your chest, making sure that their tummy is well supported, and you can apply firm, consistent circular pressure to help get that burp out. You can also lie your baby down in your lap and burp them that way, but make sure to wait at least 15 to 20 minutes after a feed in order to manage spit up. Keep in mind, spit up is normal between the first 0 to 3 months after a baby is born. That's because your baby's esophageal flap is still learning how to work well. So keeping your baby upright after a feed for at least 15 minutes will help manage that. Feeding is a new skill and it takes time to develop, and it gets easier feed by feed. And honestly, it takes about a month to really feel organized around the entire process. That said, get support even if everything seems to be going well, because encouragement and affirmation can only help boost you. Beyond that, definitely reach out for help from a lactation professional if your baby has no wet or full diapers, dark urine after day 3, dark colored poop after day 4, or you have plugged ducts, signs of mastitis, or unmanageable pain at the nipple.